Hey everybody, welcome to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Omeprazole, or the brand name Losec. So Omeprazole falls into the class of PPIs, or proton pump inhibitors. It's in the same class of medication as pantoprazole, or Pantaloc, which we discussed in one of our earlier videos. It works by inhibiting the exchange of potassium and hydrogen on the hydrogen-potassium ATPase pump. It is effective in both basal acid secretion as well as stimulated acid secretion. And the extent of inhibition is typically dose dependent. In terms of indications or reasons the medication would typically be prescribed, it can be used in any case where a suppression of acid secretion will help the individual. Oftentimes we see this necessary if somebody has a duodenal ulcer, a gastric ulcer, or either one of those two ulcers which is induced by an NSAID or a non-steroidal anti-inflammatory drug, such as ibuprofen or Advil. It can be used in symptomatic GERD or gastroesophageal reflux disorder, as well as reflux esophagitis. The hypersecretory condition, Zollinger-Ellison syndrome, can be helped with PPIs. And not just omeprazole, but PPIs in general are often one of a couple medications used in a cocktail to help combat H. pylori in the gut. Now, before someone actually is prescribed and starts using omeprazole or Losec, there are some contraindications or warnings that they should be made aware of. So for starters, no one should use this medication if they're hypersensitive to omeprazole or any component of the tablet or capsule. When a gastric ulcer is suspected, Losec shouldn't be used until the possibility of malignancy is ruled out, because if you start taking Losec without the proper diagnosis, it could actually mask symptoms and then diagnosis would be delayed. Now, there are also some precautions that people should be made aware of as well. Because geriatric patients showed an increase in bioavailability with this medication, typically we wouldn't go over a dose of 20 milligrams in the older populations. Patients with hepatic insufficiency or liver issues do show an increase in bioavailability by about 75% of the medication. Again, bioavailability meaning the amount of medication that actually gets into your bloodstream. However, a 20 milligram dose taken once daily for a few weeks actually showed to be tolerated in these patients, so it's a good idea to keep at 20 milligrams. No dose adjustment is required if an individual has renal insufficiency. It should also be made aware that omeprazole is metabolized by the CYP3-450 system, so there are several medications that could interact with omeprazole. So when somebody does start using this medication, typically it's taken at a dose of 20 milligrams once a day. Oftentimes with PPIs in general, we recommend people to take the medication about 30 minutes before breakfast. If someone was to develop a duodenal ulcer, they would typically take 20 milligrams once a day for about 2 weeks. If after these 2 weeks the ulcer was still occurring, then they could take the medication for an additional 2 weeks, followed by another evaluation. In refractory patients with the ulcer, they can move from 20 to 40 milligrams taken once a day, and typically it would take about 4 to 6 weeks to see resolution. For individuals with a gastric ulcer, they would take 20 milligrams as well, once a day. However, it usually takes about 4 weeks for this one to resolve, and then if you didn't have complete resolution, you could use the medication for an additional 4 weeks. We typically follow the same rules if it's an NSAID or non-steroidal anti-inflammatory drug induced ulcer, in that we still use 20 milligrams once a day and it takes about 4 weeks for resolution. Many people that use this medication simply take one dose in the morning to help suppress that acid if they're experiencing GERD or some other symptoms similar. In terms of side effects with omeprazole, it's actually very well tolerated. Most side effects have been transient, and there hasn't been a consistent relationship established between those side effects and the medication. There are some side effects that occur over 1% of the time. For example, diarrhea happens in 2.8% of the population, headaches in 2.6%, flatulence in 2.3%, and sometimes some abdominal pain in 1.7% of people. Constipation can happen 1.3% of the time, and dizziness can happen 1.1% of the time. There are some other adverse effects listed, but as I mentioned, there's not a consistent relationship shown through studies between these side effects and the medication, and they all happen at a percentage less than 1%, so we're going to leave those out of this video. If somebody was using the medication long term and they wanted to stop the medication, it's important to be aware of this fact. When you stop taking a proton pump inhibitor, occasionally your stomach can actually secrete more acid than it was previous to taking the medication. This is known as rebound acid secretion. For this reason, it's important to note that not necessarily to jump right back to the medication if you do experience side effects after stopping it, because it could just be this rebound. So oftentimes, instead of stopping cold turkey, you'll go from 20 milligrams maybe down to 10 milligrams and use that once daily for a few weeks. The best thing to do is just to keep your doctor and pharmacist up to date if you do intend to stop the therapy. That's all I really have to say about omeprazole. As I mentioned, we did do another proton pump inhibitor, pantoprazole, one of the first couple of videos, so if you want to check out that one, you can just find it in the video section of the channel. As always, this channel is for information purposes only. Please don't use this channel as a source of recommendations for your personal health care. If you do have any questions about any of the medications I cover, just direct them towards your personal health care provider. That's it for today. Take care.